the state capital while unveiling his short and long-term plan for the sector before members of the West African College of Physicians at their 43rd annual general meeting. Our correspondent, Michael Adesanya, reports us package from our studios.
The Nigeria healthcare delivery system has continued to face major challenges ranging from policy somersault, limited public funds, high infant and maternal mortality with its attendant effects on life expectancy. Apparently, not oblivious of this fact, this gathering, which comprises of doctors from different medical specialties in the area of family medicine, mental health, laboratory medicine, are here looking for possible solutions to address these challenges. While announcing the restructuring of the state health insurance scheme, he however called for an effective collaboration with the private sector for training, retraining and infrastructural development of the sector.
Also examine the impacts of social ills on the contemporary health of Nigeria, because with the increasing rate of poverty, many people are now turning to alternative healthcare solutions. We need to resuscitate the previously abandoned post-social. We need to resuscitate the primary healthcare program of the country, because this forms the basis for which we can reach the poor, especially in the rural areas, the neglected population of this country. At this time in our national development, as healthcare indicators are not very encouraging. Previous interventions to improve these indicators, although yielding results, but evidences have shown that there is still a lot of room for improvement. The solutions to current challenges of internship and residency training positions are very critical to the performance of our health systems. These have led in recent times to massive exodus of young professionals to other parts of the world. This is obviously a time bomb which we need to address now for a better healthcare future.
Representing the Permanent Secretary in the Federal Ministry of Health, the Chief Medical Director of the Federal Medical Center, Abeokuta, Professor Adewale Musa, also called for more professionalism, training and practice.
To render these services, most of the training, yes, taxpayers' money are used to engage them. And when after their training, escaping outside the country to render services to people that will not be grateful to us is terribly unpalatable. Ladies and gentlemen, let me also say that we should look into massive training of residents. Even the few ones that get trained, after their training, you see them not trained within the training center or not to get employed. And I'm happy that His Excellency has just talked to me now. It was at the hospital and the situation was terribly precarious. We want people like you who are well trained, who have experience, and you can mentor and train the junior ones. Yes, once the environment and rural centers are advertising, definitely people will want to stay. And I've advocated that even if you are a consultant, you are a university lecturer, you decide to stay in the rural area, yes, stay there, university should recognize you, whatever papers research are able to do there, should be recognized and will be promoted appropriately.
The Ogun State Governor, Dapo Abiodun, seized the auspicious occasion to highlight some of his short and long-term planning for the health sector in the state.
We're committed to restructuring the health insurance scheme to address the identified lapses and make it more efficient and affordable. We're committed to partnering with development financial institutions, DFIs, and NGOs such as WHO, Federal Ministry of Health, local and international foundations to provide better healthcare outcomes. We're committed to connecting healthcare centers to the broadband internet to leverage on ICT for centralized health records and management system to develop a reliable database on healthcare system and telemedicine. We are committed to ensuring proportionate healthcare per capita, to improving emergency response time, to improving on life expectancy rate, to improving on infant and maternal mortality rate. But in reality, it would be foolhardy to think that a government will solely finance all the sectors of the economy. In fact, it would be unwise for any government to think that it could, on its own, finance the entire gamut of healthcare delivery and administration. In Ogun State, we are not aware of this fact. This is why our administration in Ogun State is committed to giving Ogun State a focused and qualitative governance, which is aimed at also creating the enabling environment for a public-private sector partnership, which we believe is fundamental to the economic growth of the state and the individual prosperity of the citizens.
Suggestions from these eggheads in the health sector, if properly applied, could bring the desired results for a total change in the health sector.
The Socio-Economic Rights and Accountability Project has urged the general public to use the Freedom of Information Act to ensure transparency into the education sector. According to speakers at the event, the use of Act will change corruption and accountability in the sector. Suzanne Unwodo completes this report. Access to accurate and non-prejudiced information from authentic sources is critical to citizens' participation in government activities. With this in mind, the Socio-Economic Rights and Accountability Project put together this forum to discuss the need for the general public to insist on transparency, especially in the education sector. Knowing their right to have access to information held by government officials through the Freedom of Information Act, according to experts, is vital for national development. According to speakers at the event, relying on the Freedom of Information Act, citizens will become involved in the management and activities of the education sector.
For instance, we have resources allocated to the education sector. You don't know how much, you don't know how much is being spent, so how can you even demand for accountability? All of us in our different neighborhoods, we see the dilapidated schools, and we all have one issue or another we experience directly or vicariously about the falling standard of education. So how do you advocate at government? How do you ask questions if you don't have information? So what the FY Act will do is it gives you the legal backing to ask for information, to get it, and then make request of those in power. This kind of program we are doing today, the public hearing, is one of such things we are doing, educating the public and giving them practical guidelines and how they can use the act.
The law provides the framework for accessing information. The law offers us a significant paradigm shift from where we needed to appeal and beg for information to a framework that compels public institutions to collect, collate, and make readily accessible information to the general public.
The father said that the act will strengthen citizens' capacity to demand transparency and accountability from government officials, thereby challenging corruption in the education sector.
If those in government at those levels see that people can ask and demand for information, I believe the cankerworm of corruption will go down, there will be more accountability, and the process in that sector will be open. So I think it's a step in the right direction that SERAP is doing to bring about the use of Freedom of Information Act in the educational sector.
Stakeholders in the fight against tuberculosis under the aegis of the Stop TB Partnership Nigeria have converged on the Federal Capital Territory to seek ways to eradicate the disease by the year 2030. Many of the medical experts at the National Tuberculosis Conference in Abuja have lamented increasing cases of the disease in Nigeria. Basil Okafo has more in these reports.
Gathered at this hall are medical experts, international